The Agency for Healthcare Research and Quality, located in Rockville, Maryland, a suburb of Washington, D.C., is one of 12 agencies within the United States Department of Health and Human Services. The agency was established as the Agency for Healthcare Policy and Research as a constituent unit of the Public Health Service under the Omnibus Budget Reconciliation Act of 1989, December 19, 1989, to enhance the quality, appropriateness, and effectiveness of healthcare services and access to care by conducting and supporting research, demonstration projects, and evaluations, developing guidelines, and disseminating information on healthcare services and delivery systems. However, AHCPR became controversial when it produced several guidelines that some thought would reduce medical drugs and procedures. This included concern from ophthalmologists on a cataract guideline and concern by the pharmaceutical industry over a reduction in the use of new drugs. When the agency produced a guideline that concluded that back pain surgery was unnecessarily and potentially harmful, a lobbying campaign aided by congressmen whose backs had been operated on changed the name of the agency and scaled back the guidelines program, which now exists as the National Guideline Clearinghouse. AHCPR was reauthorized December 6, 1999, for healthcare research and quality under the Healthcare Research and Quality Act of 1999, which amended Title IX of the Public Health Service Act. History. During its early years, the Agency for Healthcare Policy and Research implemented large multidisciplinary, multi-institutional projects that focused on patient results in certain medical conditions in an effort to improve clinical practice. This has included basic health IT research, patient safety research on wrong-site surgery, medical teamwork, and hospital-acquired conditions such as MRSA and VRE. Funding. The 2015 budget for Ahrq is $440 million, $24 million less than FY 2014. Within this total, the budget includes $334 million in public health service evaluation funds, a decrease of $30 million from FY 2014, and $106 million from the Patient-Centered Outcomes Research Trust Fund, an increase of $13 million above FY 2014. The FY 2015 budget is intended to ensure the agency continues its progress on health services research to improve outcomes, affordability, and quality. The budget also supports the collection of information on healthcare spending and use through the Healthcare Cost and Utilization Project and Medical Expenditure Panel Survey. The FY 2015 budget provides $73 million, an increase of $1 million from FY 2014, for Ahrq's patient safety research and dissemination projects that prevent, mitigate, and decrease the number of medical errors, patient safety risks and hazards, and quality gaps. The budget includes $23 million, of $6 million decrease from FY 2014, for health information technology research, and the development and dissemination of evidence and evidence-based tools to inform policy and practice on how health IT can improve the quality of American health care. In FY 2015, Ahrq will provide $20 million to support 40 grants for foundational health IT research to inform and support the meaningful use of health IT. Leadership. Dr. Andrew Bindman was appointed as the director of Ahrq in April 2016. Prior to joining Ahrq, he served as faculty of UCSF School of Medicine. Sharon Arnold, Ph.D. was acting director from February to April 2016, replacing Richard Kroenig in February 2016. Richard Kroenig, Ph.D., was director from 2013 to March 2016. Carolyn Clancy MD was the director from 2002 to 2014. Divisions. The agency has multiple offices and centers, including the Center for Evidence and Practice Improvement, the Center for Financing, Access and Trends, the Center for Delivery, Organization and Markets, the Center for Quality and Patient Safety, the Office of Management Services, the Office of Extramural Research and Priority Populations, and the Office of Communications. The Office of Communications was previously known as the Office of Communications and Knowledge Transfer. Within CEPI, the evidence-based practice centers develop evidence reports and technology assessments on topics relevant to clinical and other health care, organization and delivery issues, specifically those that are common, expensive, and/or significant for the Medicare and Medicaid populations. With this program, AHRQ serves as a science partner with private and public organizations in their efforts to improve the quality, effectiveness, and appropriateness of healthcare by synthesizing the evidence and facilitating the translation of evidence-based research findings. Topics are nominated by federal and non-federal partners such as professional societies, health plans, insurers, employers, and patient groups.